I'm Dr. S.B. Gupta. I'm consultant physician cardiologist, ex-HOD Central Railway Headquarters Hospital, Baikla, Mumbai, and ex-physician cardiologist, Asian Heart Institute, Mumbai. My topic is weight of the lockdown, managing obesity in the era of COVID-19. As all of you know, that during the COVID era, people have gained weight. Why? Either because of the changed eating habits and less of physical exercise. That has led to obesity. And obesity has been found to be one of the risk factors for severity of COVID-19 disease, morbidity, and mortality. Now, as all of you know, that the obesity is associated with a lot of comorbid conditions like diabetes, hypertension, cardiovascular diseases. But because of these comorbid conditions, and there is increased severity and morbidity and mortality of the disease with obesity. But obesity itself is an independent risk factor for COVID-19 severity and mortality. Now, why obese people are more vulnerable for severe COVID-19? Because obesity itself is associated with a lot of problems because they're hypoventilating, difficulty to intubate them, and during their lung capacity is less, and they are vulnerable to pneumonias. Apart from that, the adipose tissue itself is like an endocrine organ and releases a lot of cytokines, which causes inflammatory reaction. In obese people, there is impaired innate and adaptive immunity, either because of the deposition of adipose tissue in the lymphoid organs, or the insulin resistance or increased leptin levels are also the cause for impaired immunity. Apart from that, obesity itself is a hypercoagulable state, and you can see there are a lot of thrombogenic complications during COVID-19, and this may be the factor why the obese people have got more thromboembolic complications. Apart from that, in the adipose tissue, there are ACE receptors, and this COVID-19 virus needs ACE receptors to enter the human body. So the adipose tissue becomes a reservoir for COVID-19 virus, and that can lead to the severe disease in obese persons. Now, whether the obese persons have got different protocols for the management, no, there are no different protocols as far as the management of obese persons with COVID-19. But obese persons should be told very clearly that they should be more vigilant as far as the COVID-19 symptoms are concerned. And if there is any symptoms, they must seek medical attention at the earliest. Also, over the world, I think everybody should be told to maintain an ideal body weight so that the risk factor for the COVID-19 decreases. Apart from that, the COVID-19 people, they shall keep their blood sugar, blood pressure under control, and they must contact their physician regularly and seek medical attention at the earliest in case of any COVID-19 symptoms. So that is the key factor. So because of the obesity itself is a risk factor for disease severity and mortality, but because of the pro-inflammatory state, impaired immune system, hypercoagulable state, and because of the ACE receptors which are present in the adipose tissue, the obese persons becomes more persons for the disease severity and morbidity and mortality in COVID-19 persons. And there are a lot of studies are there where they have shown that the mortality in the obese person is almost twofold. There is increased hospitalization in the ICU of the obese persons. They require more invasive mechanical ventilation, and so and so forth. So we have to ask the obese persons to maintain ideal body weight and seek medical attention at the earliest. Thank you.